They talked me into starting. I'll start. My name is Molly Rutherford, and I practice in Kentucky. My route to direct primary care is interesting. I trained in Virginia, and then my husband and I moved out to Kentucky after residency, and then almost immediately identified a problem with the opioid epidemic in Kentucky. So decided to become certified in addiction medicine. Well, first, I just got my X number for buprenorphine, which you don't even need anymore. But I enjoyed that work so much, I ended up becoming specialized in addiction. All of the clinics that I worked at doing addiction were direct pay because at the time, addiction medicine was not covered. It wasn't really substance abuse treatment was not really a covered service in Kentucky and really not most places. So I was able to spend time with my patients. So I got a little taste for what it was like to do medicine without having to worry about, checking the right boxes and billing codes and so forth. Just sitting in front of a patient and having a conversation and getting to know that patient and forming a relationship and helping them. So that coupled with some burnout when I was working for a patient-centered medical home from 2011 to 2014 inspired me to look into the direct primary care model. I spoke to Dr. Josh Umber from Allison on the phone, and he gave me a pep talk, and so I was absolutely convinced that I could do it. And then I had my husband helping me as well. He owns 50% of the practice, and he's sort of the business side of things. He has a business degree, even though he's a homicide detective. He helps me with that, and we basically came to the agreement that if we couldn't make it work, if I couldn't make direct care work, I was going to find something else to do, and he supported me in that. It's gone really well. My practice built pretty slowly, I would say, but because I was doing the addiction medicine on the side, and then I had some other moonlighting jobs, my income did not really suffer. And it's just been a great fit for our family. I have more time to spend with my kids. I have 2 boys. They really needed me to be there, especially with the homicide rate in Louisville, Kentucky, and Chris not being home much. So it was everything lined up perfectly. And I did get baptized the same year that I started my practice, which I believe that played a big part in my success. All glory to God. That's the story. And so I'm still doing addiction medicine in my practice. My practice is almost full. I brought on a nurse practitioner a year ago, and we're just continuing to grow. And then during the pandemic, we were able to have autonomy, and we were able to help people that felt like they could not get help in the system. We were able to see patients in person. So I'm very grateful.
I'm Tasha Howell. I own Direct Wound Care, and I'm in Oklahoma. A little background. Well, first I'll give credit to Jay for luring me to the Rebel Alliance. I originally was emergency medicine, did that for 10 years, and then kind of hit a crisis personally because I needed to wear my mommy hat more, and my ER shifts were just not conducive for that when my kids hit school age. So I ended up going into wound care part-time and a smaller ER part-time. That was what I cobbled together, thinking I don't think I'm going to really like wound care, but it is going to make me happier because it's better for my family. And so funny where life will take you, where you're supposed to go, because I love wound care and it was clearly what I was meant to do in medicine. And so I did that dual thing for a couple years, and then took a full-time wound care position as a medical director and at a hospital-based clinic. And it was just 4 half days when I came on, and so it went to full-time. We added hyperbaric chambers, we grew, we got in a bigger building, we added more doctors, expanded the inpatient program, had 4 hyperbaric chambers, then I started getting much more interested in limb salvage and amputation prevention, and we built a diabetic limb salvage program, which is the first in the state, and got that rolling. And I was teaching ER residents wound care there in our facility. But then, because it's a community hospital, the opportunities to scale and such were just not there. And then I kind of started getting bored with everything's running smoothly, great teams, which, is a good problem to have, I guess, but I wasn't getting energized by anything. And so then it left the aggravation of the hamster wheel that we're on, trying to see 20, 30 people a day and fighting the fight for every patient to get their insurance to pay for what you need done, and feeling slimy when the patient asks you, well, how much is this advanced therapy going to cost? And I can't give them a straight answer because who knows? I just got really sick of that and thought, I cannot keep doing this. I cannot see finishing out my career doing this. And ended up having coffee with Jay. We were already friends, but a mutual friend suggested strongly, because I was having a crisis, that I meet with him. So he told me a little bit about the FMMA and that community and did some introductions, and I talked with several folks. Almost all of them are here at the conference, with lots of pep talks. It took way more than one pep talk. And probably almost 2 years before I was ready to fully take the leap. And it definitely is just a leap of faith. But I thought, I'm so unhappy. It's either going to work or it's not, and then I'm going to be out of medicine. So I left my practice and planned to start my new practice in the spring of 2020. And then the world shut down. So I ended up with a sabbatical, which was great, but started a little bit later than I intended. And my practice now is intentionally part-time. I do some speaking and some consulting, and then the part-time wound care. And I absolutely love it. Again, the perfect pivot for me. My favorite thing is how much time I can have with the patient, and how it's a micro practice, so I don't have any staff. So I am the person cleaning the room, setting up. I'm the tech and the nurse and the doctor and the clerk. And the patient, we're just talking about nutrition or their kids or whatever the whole time. And so I'm also kind of a control freak, and it allows me to know every single thing that's being told to the patient and have a handle on what's happening with their referrals, and just be the kind of doctor that I went into medicine to be. So it's kept me in medicine.
Absolutely. So I feel like I'm going to echo so much of what's already been said as to what brought me into the direct pay world, and not just echo what you both had experienced and kind of what inspired you, but also just all of the speakers today. My story, I think, starts when I was 16. So we have only 16 minutes left. So I'm going to give you several decades of mine. When I was 16, I was actually working as a server in a restaurant. It was a mom and pop. I live in Kansas City. I grew up about 45 minutes away. And I'd always worked for small businesses where I knew the owners, and you could see the way the business worked or didn't. And one day my boss, who I didn't get along with because I was 16, I think I was the problem more than him. He asked me, he was like, do you know who you work for? And one of the speakers earlier actually posed this question, who do you work for? And because I was 16, I responded, I said, well, I work, for you, you're my boss. And he laughed and he goes, no, you work for the person who signs your paycheck. And I don't know if things have changed, but at the time, servers were paid like $2 an hour. And by the time your FICA taxes were paid and everything, my paycheck literally was zero. Like I'd receive paper checks that had zero written on them. And his point was that the person signing my paycheck in when I was a server were my clients at my tables. Like they were the ones who I needed to take care of in order to get paid. And so I was an obstinate child, and I don't think that conversation really had all that much meaning at the time, because I thought he was being mean, and I was 16. But anyway, I moved on, went to residency, and went into family practice. And at some point, it occurred to me, because this was in residency, this was the first time I ever worked for a large corporation. It was the first time I ever worked for not a small business. And it was so difficult for me to understand that I wasn't actually working for my patients. Based on that logic that my evil boss had taught me when I was 16, I was like, I'm not working for my patients. I'm working for this hospital system. I'm working for this insurance. You know, we have to click the boxes. We have to check the right things to get paid. Like, none of it made sense to me. And I had gone into medicine because I wanted to serve the underserved. I wanted to, the residency program I worked at was an FQHC. We took care of all the refugees coming in through the state of Colorado. It was an incredibly passion-driven, practice that I had. And even so, the further I got towards graduation, the more I realized that it was not serving me for a long career. I wasn't going to be able to make it in medicine for the long term if I was going to operate in that model. But it really wasn't serving my patients. And so I told all my residency directors that I was going to go into direct primary care. And I think I got like a pat on the head, like, oh, that's great. Let us know how it goes. Like, good luck. Everybody else has jobs. You know that, right? And I'm like, yeah, I'll figure it out. But anyway, so we moved back here to Kansas City from Denver, and started the practice, and had no formal business training. My husband's been incredibly supportive, and does have a degree in business as well, and has really helped me also with thinking through a lot of what we do from a business perspective. And from starting the direct primary care practice and growing it and learning about more and more about the business of healthcare, and more importantly, how to treat patients and how to work for patients and how to do what's right for patients. I've just exploded in all these different ways of participating in the marketplace, and kind of in other opportunities, business opportunities, and medical directorships, and just like getting involved quite a bit with the transparency in healthcare movement. And so a couple years ago, I had the opportunity to start to work with Sesame, which is an online marketplace for transparently priced healthcare. It's venture backed, and it's like way different. It's run by all these business people, not clinicians by any means. And so it's like a way different perspective on like, how do we approach healthcare that's very consumer driven and consumer focused. And so I have all this experience from back to my server days of like taking care of the person in front of me, which is still what I do when I do direct primary care. And then also looking at sort of like, how do you build a bigger product? How do you build a bigger thing to serve more and more people on a national basis? And so it's been a really fun journey. And actually, with the birth of my first son, we're baby number 2 is not going to come today, but soon. With the birth of my first son, I decided that running the practice and being the everything for the practice was a lot. In addition to all the other stuff that I was doing, on top of the fact that everybody who I had employed got pregnant at the same time. We can talk over drinks. You can drink. I can look at you drinking, but I can tell you the whole story. But at that point, I decided that selling the practice was going to be the best. And so I was able to sell my direct primary care practice. I still work with that practice and provide coverage for them. And so I still get to do my direct primary care. I get to work as the medical director for this national organization, and just really enjoy being here today, hearing everybody's stories, meeting with everybody who's so passionate about doing the right thing for our patients, employer groups, and for the U.S. healthcare system. And it's been an absolute joy to be part of this part of medicine and not get stuck in a big corporate entity. So that is my story and how I came into the direct pay world.
Dr. Rutherford, Dr. Edwards, both of you mentioned that your husbands had a business education. I'm curious, starting with Dr. Rutherford, when you went through medical school, residency training, do you believe that it would have benefited you now to have some type of a formal business education?
If not the education, at least the awareness of the option. I feel like even when I went through residency from 2003 to 2006, they were steering us very much towards either academia or towards, a hospital-based basically being an employee, which is a shame because I think, traditionally doctors were professionals who owned their own practice. And so somewhere we got away from that, and all of these residency directors, many of them they don't understand. Like, you can still start your own practice and you can be successful. I personally don't think it's possible within the system. I know there may be a handful out there still doing it, but most of them end up selling their practice. So if not training, at least encouragement.
Dr. Edwards, same type of question to you. What role would just formal syllabus, coursework have played if it was, hey, this is accounting 101, this is marketing 101, something just very elementary that the vast majority of undergrads do go through? What role would that have played in your practice?
I would not have asked as many stupid questions first, certainly. I would have the terminology down much faster. And honestly, it may have scared me into not opening my business, perhaps. Only because it took me several months after opening my doors to realize that I was running a small business. Like, conceptually, I was like, oh, I'm just a doctor. I'm just a doctor serving patients. And then several months into it, was like, oh no. Like, I've opened a small business. Like, I got to get good at this, and I got to get good at it quick. And so, perhaps it would have even been paralyzing to be like, oh, I know, like, this is going to be a hard thing, and I need to, get my ducks in a row before I start. Whereas I sort of just jumped in and then learned how to swim, and I didn't drown. So that's nice.
I think what you two just echoed is something that anybody in the audience who started a business, and there's quite a few, would probably say the exact same thing. So we hear a lot that's like, oh, doctors don't make great business people. There's just no business education. I, for one, wouldn't go out and start a hot dog stand without at least calling a lawyer, calling my accountant, calling city officials to figure out, am I going to get arrested, or am I going to go to jail if I make a mistake here because I don't have the right type of permits? So I hear that refrain a lot that, well, doctors, we just don't make good business people. And I'm saying, you're not alone. You're not alone in what you're talking about here. Education today just does not do a good job in any type of major, any type of concentration of preparing people to become entrepreneurs, to become business owners. I think, Dr. Rutherford, they teach you how to be great employees, cogs in a wheel almost. So I just want to throw that out there, that you two are not alone. The sentiment of that is not something that is just established in medical school versus going to business school or even going to graduate school. I want to go to Dr. Howell. You mentioned your lifestyle. You wanted to focus on your family more often. Again, you're not alone in that sentiment. In your opinion, what has been the biggest benefit to really going out and becoming your own boss?
I'm so happy. Everyone around me remarks how much happier, smiling, healthy. I just was working so much and so stressed, and clearly now see that I was suffering severely from burnout, but I didn't really recognize it at the time. And it feels good. And my husband's like, okay, now you said you were going to work part-time when you took that wound care job. And so is this going to be this thing that just snowballs into it's full-time, and then it's taking over our schedule and our lives? And I think even if that started to present itself, the answer would be, no, that's not going to happen, because I'm enjoying this so much more.
Dr. Rutherford, in a previous session, you talked about how your practice was able to survive the pandemic. What do you say to people who say, oh, this isn't the way that medicine should be practiced? You shouldn't have a clinic like this.
That's not the truth. I would just say that's false. This is exactly how medicine was meant to be practiced. If you look at the original Hippocratic Oath, and if you look at the most medical students' personal statement, almost everyone, and I think they're being honest, go into medicine because they want to help their patients. They want to serve their community. They are driven to serve, basically. So the system, the cartel, does not allow doctors to serve their patients. They're serving the masters, the administrator, the hospital system, the insurance companies. So, I think I would just tell the truth.
I would echo that like the reason, I think we're in this room today is because, not to toot our own horn, but clinicians like ourselves stepped out and said, we're not going to deal with this anymore. And we said, this isn't the way that patients want to be treated, and this isn't the way doctors want to practice, and this isn't why we went into healthcare in the first place. It's not that hard. This is why we're doing what we're doing, and this is the common thread that brings us all together, is because we want to do, right by everybody.
But I understand why some doctors are reluctant or fearful of making that decision, because the reality is, if I went back to the system now and it was purely about my income, I would make more money in the system. I'm just being honest. So you have to decide what your values are, and I think most of us started out with that value that we want to serve our patients. So what we definitely need to do is try to recruit more medical students, try to recruit more residents, try to convince more of the academics that are teaching medical students and residents that this is truly, the way forward.
Dr. Evans, working for a virtual care platform, what role does virtual care play in your previous practice, but still amongst direct care?
I love virtual care. I don't know how much you spoke to in the last session. I wasn't able to attend, but especially during COVID, it was like revolutionary to be able to just within minutes be able to talk to our entire DPC practice and say, nothing changes. Like, we're still here for you. You know how to get a hold of us. We can do telephone, we can do video. We did a lot of car visits out in the parking lot, which in my entire career, I would have never imagined that I was going to drag an otoscope and a chair out and sit at the driver's side, just chit chat with somebody at their car. But this is what we did because we could, and we wanted to keep serving our patients. Not virtual care, I realize, when you're sitting in a parking lot, but it was part of the whole package of direct primary care, is that we were able to provide that continuity and that comprehensiveness. In Sesame, it was interesting because it shook everybody and changed everybody's lives. It was a really quick transition where we were able to essentially say, this is the obvious thing that the U.S. needs and that we all need right now, is to provide more direct access, in a direct-to-consumer model with an affordable and transparent price that doesn't include networks, that doesn't include insurance, to get people connected to care. And so it was crazy because we had been market-focused and local in geography and kind of exploded into more of a national footprint, and had seen it be incredibly successful.
Now, during COVID, when the hospitals magically invented this new way to see patients, and they're saying, wow, we can do teledoc, we can do all these virtual things, did it make any of you chuckle, saying, we've been doing this for years?
Mm-hmm.
Yeah. Felt real good.
And we didn't have to worry about some law being passed or what the code was so that we could get paid for,
Right,
Yeah.
like the emergency authorizations and changes and everything. It's just like, no, this is just normal. We use telephones sometimes.
This is the DNA of our practice.
Yeah.
We didn't have to change anything so that we could get paid because we can't see anybody in person like we talked about today. So last question for you. We've heard today that when we talk about what we do, we have to hit the challenges that our customers face. So give us 3, maybe 5 words. Dr. Rutherford, we'll start with you here. What is the biggest challenge your practice solves?
Access and relationship.
Dr. Howell?
I would say commitment to get them healed at whatever that takes.
I would say the pain point that we solve the most would be just transparency and accountability.
Well, ladies, thank you so much for your time up here.